Okay, so we're doing our presentation on the Hmong culture, and as you may be able to see, we're having some technical difficulties, so you can also find an attachment of our PowerPoint to follow along with our presentation. So we're going to start off with just a brief history about the Hmong culture and how they originated, or not originated, but got to the U.S. So the Hmong culture is an ethnic tribe group who was originally from southern China, and they had concentrated populations throughout Southeast Asia, especially found in the mountains of southern Laos. And on this map, you can kind of see where the mountains were the white star, and how Laos compares to China. So following the Vietnam War, the Hmong started immigrating to the United States to escape prosecution for fighting communism alongside of the United States. So historically, the Hmong population is medically underserved. The Hmong community continues to face numerous barriers to healthcare as a result of their culture, language, and lack of access to healthcare in general. Interestingly enough, 80% of the Hmong Americans live in California, Minnesota, and Wisconsin, and this culture is dynamic and ever-changing. However, given the regions, and we are in Minnesota, that this is a population we will likely be serving a lot as future nurses. So you now know that the Hmong within Minnesota is a significant part, and we can expect that they will continue to grow in the future. Therefore, knowing how to effectively communicate with this population will only benefit us as future healthcare workers. So going into communication, it's effective to know how they communicate so we can effectively communicate with them. So there are two major dialectal variations among the oral Hmong language. So we're just going to say the white Hmong and blue Hmong, but there is some more complex words for them. Hmong is spoken using one of 8 tones, and the Hmong are primarily an oral cultural group. So this statement applies that some Hmong have never learned to read or write Hmong. They can just speak it. So this is something that we should keep in mind, that their written word is the primary tool and the mechanism for passing on traditions, rituals, and information to future generations. However, this can be contradicting because not all of them know how to read or write. So, I don't know. Just take that how you want to take that. So the picture you see here is actually, interestingly enough, from an annual Hmong festival that takes place in Minnesota. And this festival focuses not only on sharing the culture with other Minnesotans, but also gives the Hmong an opportunity to share their culture to their children. So they really take pride in this. So in this picture, we see the typical Hmong dress and dance being performed by some of the children that do reside here in Minnesota. So expressing cultural awareness, if appropriate, especially being the nurse, we kind of have to judge where we are at personally along with where our patient is at, is important for everybody and will help gain the trust of our patient. So we need to assess the written and oral communication skills of our Hmong clients in the Hmong language as well as the English language. So for some Hmong, the oral words hold greater meaning and power than does a written word, so care can be hindered when it is given in the written form. So they closely pay attention to the nonverbal communication to help them understand the English words. This is even utilized by them when an interpreter is present. So keeping this in mind, they will commonly nod their head and use the word yes, which to them means that they're listening. However, for the Hmong population, this also is a communication technique that they utilize when they respect somebody. And for most Hmong that have grown up in America or have had positive family experiences within the healthcare system, they will nod, just to show their respect, not because they understand. So raising one's voice is also something that will lose respect of the family. So as Americans, we have the tendency to naturally raise our voice when somebody can't hear us or maybe when they're not understanding us. However, being culturally aware of this difference is crucial in us gaining the respect of our Hmong patients. Even if they are hard of hearing, the Hmong find it extremely disrespectful if someone is to raise their voice at them. Okay, so more communication in healthcare. So both ways. So some Hmong have developed a skepticism towards U.S. healthcare. However, this can depend on the family's experience, and a lot of this can stem back to significant history from the Vietnam War. If the family has had a positive experience or they've seen how the U.S. healthcare has saved a loved one or transformed their life, they're most likely to be more involved in this as well. However, they will decline immunizations, blood tests, preventative screenings because they don't understand what exactly they will do to them, how they will benefit their lives. So as nurses, we need to routinely explain recommendations, including what the intervention is or the procedure is, what will happen to the patient, why it was needed or is needed, and what will happen next. So the language barrier is obviously a large interference with access to healthcare and immunizations in the Hmong population in general. However, we need to keep in mind the effect that this can have on children. Just because my Hmong mother doesn't understand why I need to get my immunizations, we need to kind of walk through that, because wrapping our head around the whole concept we hear about a lot, these children are in our school systems, and if they do have the proper education and immunizations, they are not opposed to them, which, as we know, can be a benefit. So this is a picture of baby Kyrie, and may or may not be familiar, but she was selected as the 2019 Gerber Spokesbaby, and this is the first Hmong Gerber Spokesbaby. So just kind of a fun thing. You can see that the Hmong are gaining a huge part of the American population and being accepted. So, yeah.
All right, so I'm Mandy, if you don't know me, and I'm going to talk about space today. So my goals today are to cover what is space, what does it look like in the Hmong culture, and the role of the clan in respect to this idea of space. Before we get started on mine's a little bit messy because it has everything to do with what everyone else is speaking about today. Just because communication, the relationships, tone of voice, all of those things have to do with communication, yet it has everything to do with space. So it'll kind of go over everybody's, but it's super important and very valuable to understanding the Hmong population. So first, I just wanted to define what space actually is. I know we probably know, but it's good to get a really good foundational understanding. So this quote is actually from some research that was done by Hope College and Efat University. They discussed 7 components to space, and they define cultural space as the concept of physical boundary and territory can be defined as cultural space. So these universities in 2014 did a lot of different research about culture and like what matters. And so what they had to say about space was that it can kind of be seen as your personal little space bubble. And so it can either enrich a relationship or it can really cause anxiety to a relationship, just depending on what the culture views it as. Some other examples that they provided, so intimate distance and personal distance are both examples of space. So like how me and Adeline are standing right next to each other, we're okay with it, but she might get really uncomfortable if I get right next to her. So that is an example of intimate space, and so it really looks different among a lot of people. Other examples of space are like touching, eye contact, tone of voice, and also we'll get into this in another slide, but like how your culture is present is kind of like an abstract idea, but it also plays a role. So those were some examples. So next, I wanted to talk about ethnic identity and how that plays a role in the space in the Hmong culture. So a research article done by Tiffany Yip in 2014, which was called Ethnic Identity in Everyday Life, the Influence of Identity and Developmental Stages. This was published in a journal, and it talked about how ethnic identity plays a really big role for some cultures, and in the Hmong culture, this is what space is all about. So here's a definition of it from this research article. The way in which individuals come to understand the implications of their identity and make decisions about its role in their lives. So this is how I was kind of talking about this abstract idea about how culture is space. I was trying to wrap my head around it, and it was a little bit confusing. But what the Hmong culture really values is their culture being present around them all the time. For example, so say you're working as a nurse in a hospital and you walk into a room, you're probably going to see a bunch of family members present, and that's because they like people from their culture and things they value. They like to be around them all of the time. They're not ones who are wanting to maybe go out and be independent and maybe try different things. They're more comfortable and more trusting and more secure when they're surrounded in their own culture and identities. So another example, like we could use me as an example. Like I would be pretty comfortable kind of being involved in any kind of culture, and I would be really open, and that's good because I'm going to be a nurse and I have to have those skills. But for someone from the Hmong culture, it might be really, really challenging to just like go and be with a bunch of different people at one time. It would probably be overwhelming. Also, this article talked a lot about Erikson theory of development and how this actually might may be very challenging to an adolescent Hmong, because during this time, Erikson talks about for adolescents that identity crisis and like this idea of commitment. And so people in the Hmong culture actually might be really challenged by this. And they might be like, well, I'm a teenager Hmong and I live in America, but my culture really values this. Do I want to be a part of that, or do I not want to be a part of that? And it really is a barrier and a challenge. And with everything that Jolene talked about how prevalent Hmong culture is, I think we'll probably see that a lot. And this all has to do with space because it's all about who you're around. So that's kind of the connection there. And I just provided a picture of some Hmong individuals. And the next thing I want to talk about is the value of clan and space. And I don't really want to get super into that because I know Adeline's going to cover that heavily. So here are a few things that are a value of space. So the clan. So the clan is the core to the culture, and I won't get into specifics, but they really value family, and their family is large and extended. So it's not just like brother and sister. No, it's like probably a lot of siblings. It's probably cousins. It's probably nieces and nephews all together all the time. And the emphasis, like what makes people in the Hmong culture feel safe, secure, and trusted is the family around them. And they just really like the presence. So I wanted to talk about a few verbal and nonverbal communication things from Marcia Quartet, and this was published in 2012 about providing healthcare to Hmong patients and families. So just like Jolene talked about, communication is hard because they might not know English, they might not be able to read English, those kinds of things. So the best thing that you can do as a nurse is to really explain, use an interpreter, and be an attentive listener, because they may be nodding their head yes, but that doesn't mean they understand it. And then the other thing I want to talk about space, so obviously as a nurse you want to like look them in the eye, but sometimes that's seen as rude or disrespectful. So you really need to just assess the situation and see like what you can do, especially because you are in an intimate space and they will be accepting that you're right there with them because you're trying to help them. But there are other things that you may need to think about during that. And the last thing I wanted to talk about for that is the tone of voice and body language. So use a normal tone, not how I'm kind of like jumping up and down. They're pretty like monotone. Everything stays pretty same. It's very calm. So the best thing you can do is just respect that. And when you're in their room working with Hmong patients, like just use your regular tone of voice. Just be calm and collected. And then for body language, like show that you care, and like it's already hard enough if they don't speak English. Don't turn your back to them. Just be open to them. And that is probably the best thing you can do. One thing, I had some Hmong patients my first semester, and I really wish I would have known some of this because it was really hard for me being a first semester nursing student caring for people who did not speak English. But honestly, their clan was present, like lots of brothers and sisters, and then like there was some cousins there, and I honestly utilized the clan the most my whole time, and it really affected my quality of care. And so the best thing you can do is just embrace this person's culture and just make the most of it, because good things can come from it, and it will really positively benefit them. So that is all I have to say, and the next one will come. My name is Adeline, and I am going to be talking about social organization within the Hmong culture. First, I'm going to define what social organization is, and it is a shared identity that's related to social and cultural heritage. And these are learned behaviors that we acquire through socialization within our social groups. And for instance, the social groups would be family, religion, tribes, and ethnicity. And I have a quote here from our Transcultural book, Geiger. Probably not saying the name right, but sorry. Um, she quotes that it's important for nurses to understand the behaviors of patients because our cultural relation is linked to our physiological and psychological growth and maturation. So it's really important that as nurses we understand that our social organization can impact your physiological and psychological well-being. So first, I'm going to talk about the Hmong family. Family is such a big deal within the Hmong culture because that's where they have their support system. That's where all the support system lies. So their family is structured as clans, and clan by definition is pretty much it's like a group of people from the same ancestral. So to be a part of the clan, the Hmong clan, it has to be by birth or through marriage, and that's how you become a member of the Hmong clan. So, and there's like 18 different types of clan within the Hmong culture. For instance, you have the Yang and the Ching, and the other, and there's like 18. Yeah, those two are the examples that I have. And family is like it's they have a family system is interdependent and not independent because the family members will rely on each other for support, and interdependent is pretty much like they depend on each other. They're not like the Western where it's like, okay, we're grooming you to be independent. It's more like we're going to depend on each other for support. So that's how the Hmong culture, and it's really important for the nurses to understand that because, for instance, if you have a patient, don't be surprised that if you have a patient in a hospital, you're going to have the whole family, just like our previous classmate said, you're going to have a whole bunch of family members in that room visiting or trying to be there for that support, you know. The next one is to have extended family, which is pretty much kind of similar. It's multi-generational family like, so it's going to be it's not going to be the typical mom and dad and kids. It's going to be the mom, dad, family, uncle, aunts, nieces, you know, just the whole group of family. And it's the same as the clan. So it's like the family is kind of the clan. So when you have it's like the chain clan, everybody, the nieces, the uncles, everything together. So again, goes back, if a patient is in the hospital, you may come in there and you're going to see the whole clan of family in there for support. So nurses should be aware of that. Roles in the family. So in marriage, first I'm going to talk about marriage. So within the Hmong culture, they practice the exogamy marriage, which is like individual from the same clan will get married to individuals from another clan. So if you're a Chang clan, you cannot marry from someone within the Chang clan. You have to marry a different clan, and the reason being is to prevent any biological implication. So just a fun fact to be aware of if you're a nurse, and also understand that all the different types of clans are different. You know, we cannot assume that each clan is the same, you know. So someone from the Chang clan has different beliefs or traditions than someone from a Yang clan. So as a nurse, do your proper assessments, making sure that you're getting
all the necessary assessments towards that as an individual patient and not necessarily as a Hmong patient, because again, they're all different. They have different clans within the Hmong culture, so proper assessment would be very good. Then roles in the family. So the husband side is the primary decision maker. So he gets to make most of the decision in the family, and the mother is more of the emotional support. So, however, when I did a little further research from Gardner, that's the author of the article. So, though the husband is the primary decision maker in a healthcare setting, the family as a whole is the one that gets to make a decision if someone, for treatment purposes or diagnostic purposes, because if one person is sick in the Hmong culture, it's more like it's going to impact the whole family. It's that interdependent thing that goes on. It's like one person is sick. Just because one person is sick, that means all of us are going to get impacted. So we have to come together as a group to make a decision as to what to do, what kind of treatment do we think is good for that person. So I'm going to give an example. When I used to work at North Memorial, we had, as a nursing assistant, we had a Hmong patient who was really, really sick, and he was at a point where his organs were failing. So he had been in the ICU for like 3 months, and it got to the point where the doctors wanted the family to make a decision, on what to do. Are we going to just leave him on the vent, or are we going to, pull the plug? So the wife and the kids were there. However, because of their family bond and because of the fact that it's not only the wife that gets to make a decision, it's like the whole family. So the family, they had to come together to make that decision. And believe me, it took a week for everybody to come together, because they had families all over the United States that had to fly down to Minnesota so they can sit around and have a conversation with a doctor before they could come up with that decision. So it takes the whole family to make a decision, so which is really important. So for nurses, it's important to know that, because if you come in encounter with that, just be patient. It's their culture. Be respectful and provide them with the comfort that they need at that moment. Religion. And religion is another social organization that allows us to learn behaviors. Religion. So Hmongs are spiritualists and Christians, and shamans are part of the spiritualists, and they're very influential in the Hmong culture. And you would see most of the elderly Hmong individuals that will seek the shamans for health related advice or treatments or something. So as nurses, you just want to make sure you're doing proper assessment of your patients to ask them if are they taking any herbal treatments, or are they seeking health related advice or treatment somewhere else. And of course, if you encounter among Christians, you want to provide them with spiritual, like godly, care. Yeah, thank you. So this is an example of a shaman, and these are their tools that they use when they're doing the spiritual ceremony or healing ceremony. These are the nursing implications. I think I kind of went over that as I was talking, so thank you.
Okay, perfect. I'm Shanna. I suppose you probably already know me. But so I did environmental control, and I wanted to start out with the definition of environmental control, and this is the ability of an individual or persons from a particular culture group to plan activities that control nature. So I thought this definition was interesting because when I think environment, I think a geographical location. And that's not how Geiger wants us to look at environmental control for our patients. And it wants us to think that it's a term that encompasses relevant systems that affect an individual. And each culture has their important relevant systems for their culture that affect their community. So this is very important because this ties in health to community, and for the Hmong population, this is extremely important because if there's something negative that might be having an effect on their environment and their systems, then it's going to have a huge role in their health. So for the Hmong, Adeline brought up shamanism, and that is a practice of their spirituality, which I actually got to take a 2-credit course at my last semester strictly on the Hmong population, and we talked about shamanism. If anyone's not familiar, but the Hmong, how they practice this is the shaman puts their hands over the body, and it will move the energy through the patient, and it's getting out the negative energy. So this all relates to the environment. So if you're the negative energy in the room, this can totally offset the whole environment of a Hmong patient in the hospital. So first thing is you need to ask the Hmong patient if they've already been to a shaman, because the chances of an older patient, they've already been to it, so they're probably pretty sick if they have no actual hospitalizations. They've already been to a shaman, and how you can help them get through this. Yes, and so I put a picture of a shaman on there. I think that's it. That's all I have for that. So the next thing is time. The Hmong patients are normally on time for all their appointments. The only barrier that I could find and that it spoke about was that if there's no translators, this could cause them not to show up, even though they want to show up. They're normally on time. So as a job of the nurse is if you're in the hospital, you need to be the one to schedule and make sure translators are there so they understand when they need to show up to appointments, how to take their medications, because these are patients that are really good. They're going to take their medications if they know and have the right resources. The next thing I wanted to point out that I thought was super interesting that related to time was Hmong funerals. And these are a little different from Western cultures because Hmong funerals actually last a couple days. They're not in a rushed time frame of anything. And death is not negative at all. It's the passage of their body going to the next life, which interestingly enough is this can take a couple days for them to go into the life that they need to be. And so this means that Hmong patients need to cross certain they need to cross certain like landmarks and stuff each time they get into like to get to the right passageway. So beware of this if you have a patient that is near death. The Hmongs have ways that they are going to deal with the death, and they have rituals, and you need to be receptive to them because it is going to be really not reassuring for them if they can't do these rituals in their order, and can cause a lot of stress on the patient's family. And it wouldn't be good patient-centered care if you didn't allow them to do these rituals. So I attached a little video. It's not a full funeral of a Hmong patient, but it's a minute, 30 seconds, and it shows some of the different culture things that you would see in a funeral. on to our last topic, biological variations in the Hmong culture. So it is a well-known fact that people differ culturally. Cultural differences are evident in communication, spatial relationships and needs, social organizations, time orientation, and ability or desire to control the environment. However, less recognized and understood are the biological differences among various racial groups. The strongest argument for including concepts of biological variations in nursing education and nursing practice is that scientific facts about biological variations can aid the nurse in giving cultural appropriate health care. In Geiger, it stated that in the United States, white standard values for factors related to growth and development, nutrition, and susceptibility to disease are often applied to African Americans, Asians, and American Indians. Therefore, significant deviations from the norm that may be labeled non-normal might more appropriately be labeled non-white. This is huge as a nurse. If your patient comes in and they're Hmong and they have different biological variations that aren't the same as a regular Caucasian would be, and so we label them as non-normal when in reality it is normal, it's just within that culture's norm. So very important to note that as a nurse. Okay. So the shape of Hmong patients can also vary. Their body weight and structure. The women are seen as more desirable when they are heavier, and skinnier women are typically seen as less attractive. The reason that heavier women are seen as more desirable is because they are thought to be healthier and stronger and having the potential to do hard labor and produce healthy children. As far as skin color, the Hmong typically have a darker skin tone, brown skin, and their children may have Mongolian spots when they're born at birth. We should not confuse this for bruising, so if you have a Hmong patient that has a baby and you see Mongolian spots, make sure to document that right away so that it's not confused in the future for bruising. The darker the client's skin, the more difficult it can be to assess changes in skin color. So in caring for these patients, it's important we establish a baseline color to use for our future assessments. The conjunctiva, sclera, and hard palate can be used to assess skin color changes more easily in the case of jaundice, cyanosis, or pallor. Susceptibility to disease. There's increased incidence of particular diseases among each culture. Specifically, in the Hmong population, there's a high prevalence of cancers, including stomach, liver, pancreas, leukemia, and non-Hodgkin's lymphoma. Other health concerns include myocardial infarction, kidney dysfunction, bladder stones, and gout. The prevalence of cardiovascular diseases may be linked to other factors in their population. The American Diabetes Association found that in the Hmong population, it is estimated that 49% are overweight, 31% are obese, and 18 to 24% have hypertension. Each of these factors put the patient at risk for cardiovascular disease. There's also a relatively high incidence of depression among American elders. This is attributed to the losses and traumas associated with war and adjustment to the life in the U.S. However, this is not always talked about in Hmong culture or accepted, so it's important that we're aware of this and we can look into it further if we believe our patient is dealing with these issues. Chronic hepatitis B. On arrival in the 1970s to 1990s, when the Hmong were coming to the United States, about 15% of the total refugee population carried the chronic infection, while on arrival in 2004 to 2006, the rate was only 10%. So luckily this has gone down. However, every Hmong person should know their Hep B status, and chronically infected individuals should have yearly examinations. Tuberculosis. In 2004 to 2005, 52 people were diagnosed and treated for TB in Thailand prior to departure to the U.S., and 37 people were diagnosed upon arrival to the U.S. 12% of those arriving in 2004 to 2006 had latent tuberculosis. The prevalence of diabetes in Hmong patients was 19.1% compared to 7.8% in white adult patients. And all of these statistics were found in and the health and healthcare among adults patients retrieved from Stanford Geriatrics. On to nutritional preferences. So staples, first of all, our Geiger textbook defines nutritional preferences that include habits and patterns. The paramount factors that seem to determine food choices are cultural and ethnic in nature. Hmong cuisine has similarities to the food in surrounding Asian countries and is characterized by the uses of spices and herbs. Staples of the traditional Hmong diet are rice, noodles, fish, meat, green vegetables, and hot chili sauces. The Hmong tend to eat the same types of food at each meal with very little fruit or dairy products. Traditionally, sick persons or expectant mothers eat only hot or warm food. So it's great for nurses to know that if you have a sick Hmong patient or expectant mothers, that their diet may look a little bit different than your other patients that you're taking care of. Some popular dishes include pho, which is a beef noodle soup, lar, pronounced la, a minced meat salad with combined mint and herbs, papaya salad, and nava, a coconut-rich tapioca dessert served on ice. Those are a couple pictures of traditional Hmong dishes. If you are interested in trying or making one of these recipes, there are places to do so in the Twin Cities. There's a food court on the Hmongtown Marketplace on Como Ave in St. Paul, and also the Hmong Village. Some local restaurants that serve Hmong food include Mav's Egg Roll Basket, Thai Cafe, and the Hmong House. So, as far as nursing implications go for biological variations, I mentioned earlier that white standard values for factors that are related to growth and development are often applied to African Americans, Asians, and American Indians. So deviations from the norm may be labeled non-normal when they should be labeled simply non-white. As nurses, it is important to be aware and understand the difference between non-normal and non-white so we don't accidentally chart something that can be misinterpreted. We want to be caring for our patients in an accurate way that is also culturally appropriate. As nurses, we will work with a variety of populations, including Hmong Americans. Taking the time to research and understand their culture as well as others will help us become culturally competent and ultimately better nurses because of it. Thank you for listening to our presentation.